Hello, everyone. Good morning. It's a great pleasure to be speaking with you all today for the 2017 Hong Kong Health Research Symposium. Please accept my apologies for not being with you in person. Doubtless, some of you have traveled far to be here today. The long journey is, I think, a very good metaphor for how far we've come in our work against NCDs. At the turn of the century, non-communicable diseases were a tiny footnote in public health, almost a hobby for WHO. It is reassuring to see how much of this is changing. We now recognize this as a threat to all countries, but particularly in developing nations, where the double burden of communicable and non-communicable diseases pose a serious challenge to both health and human development. When the Millennium Development Goals were adopted at the United Nations, NCDs were largely absent. Yet in 2011, the UN hosted the first high-level meeting on non-communicable diseases, only the second time that a health issue has been discussed at this high level after HIV/AIDS in 2001. It was there that I and many other colleagues were part of a historic decision taken by world leaders to acknowledge that non-communicable diseases constitute one of the major challenges for development in the 21st century. This was a key moment. Since then, the profile of NCDs has shifted substantially. The role as a key determinant issue has been clearly highlighted by their inclusion in the 2030 Sustainable Development Agenda. Whilst NCDs both affect and are affected by other areas of development, the primary targets we focus on are SDG Target 3.4, which is to reduce by 1/3 the number of premature deaths from NCDs by 2030, and SDG Target 3.A to strengthen the implementation of the WHO Framework Convention on Tobacco Control. Moreover, cost-effective NCD prevention interventions represent a critical package for strengthening essential public health functions as part of a universal health coverage benefits package. This work is directly linked to fulfilling SDG Target 3.8, achieving universal health coverage. So how are we doing? The answer is better than we used to, but still not good enough. NCDs remain the largest killer in the world. In 2015, more than 39 million people died needlessly from NCDs. Out of this figure, 15 million people died prematurely between the ages of 30 to 70. These are 15 million deaths which could largely have been prevented or delayed by protecting people from key risk factors: tobacco consumption, poor diet, lack of exercise, and the misuse of alcohol. Many of these deaths occurred in middle-income countries, driven by the globalized trade of health-harming products, rapid urbanization, and population aging. The story is the same regardless of gender or income. NCDs are on the rise and are no longer the exclusive domain of rich countries. They pose a problem to countries at all levels of development, low, middle, and high-income countries. Huge disparities remain between countries about the probability of dying from one of the four major NCDs. In other words, cardiovascular disease, diabetes, cancer, and chronic lung disease. Since 2005, only the European region of WHO has witnessed an absolute decline in premature NCD deaths, with the rest of the world experiencing an increase, particularly in developing nations. The Western Pacific region, for example, which includes China and Hong Kong, of course, accounts for 27% of all premature NCD deaths worldwide, approximately 4 million deaths annually. The region as a whole also demonstrates the disparities between countries with the probability of premature death, ranging from NCDs death in Singapore at 10% to 36% in Papua New Guinea. Globally, the probability of dying prematurely from any one of the four main NCDs declined by 17% between 2000 and 2015. While very encouraging, this rate of decline is still insufficient to meet the SDG Target 3.4. So how do we as a community and as WHO change this? We need to focus on these areas: prevention, best practices, cost-effective treatment and screening, as well as practical action. Prevention, of course, is a major part of the solution. It is cost-effective and impactful. It requires tackling the primary risk factors: tobacco use, harmful use of alcohol, unhealthy diets, and physical inactivity. Limiting exposure to these risks is a complex issue, as they are influenced by forces well beyond the health sector and linked to many broader determinants of health. Successful prevention, therefore, requires a health in all policies approach, and these efforts will strengthen health efforts across multiple sectors. Cost-effective NCD prevention represents a critical part of strengthening essential public health functions, going beyond NCDs and into improving the health system as a whole. We can help countries achieve this by focusing investment on the policies which achieve the most but spend the least. The recent World Health Assembly saw the approval of an updated set of good and best buy interventions for the prevention and management of NCDs, which serves as a menu of evidence-based interventions that are proven to save the largest number of lives for the lowest cost. As one example, this includes Empower measures in line with the WHO Framework Convention on Tobacco Control, intended to assist in country-level implementation of effective interventions to reduce the demand for tobacco. Some of these even generate revenue for governments. In 2015, the Addis Ababa Action Agenda for Financing SDG Implementation outlined how price and tax measures on tobacco represent a revenue stream for development, as well as being an effective and important means to reduce tobacco consumption and associated healthcare costs. In the World Health Assembly, we also reported on the bottlenecks that need to be addressed urgently in order to accelerate action against non-communicable diseases. These include building national capacity, strengthening health systems, buttressing analytical, legal, and tax administrative capacity, opposing industry interference, and meeting demand for technical assistance, among others. We have a clear roadmap for achieving some of these in between now and the third UN high-level meeting on NCDs in 2018. There are 4 time-bound commitments and a complex but solid accountability framework which was developed by member states through political negotiations. This framework includes different sets of indicators which are continuously monitored and updated by the World Health Organization. To give an example, WHO NCD Progress Monitor includes 18 indicators to assess whether countries are fulfilling their time-bound commitments made in the 2014 UN General Assembly high-level meeting. In 2015, only 13 countries had fully achieved 10 or more of these indicators. Clearly not enough. This reiterates what I said earlier. There is some progress, but we will not meet our targets for 2030 if we continue with a business-as-usual approach. But it is at the country level where we need to turn these intentions into outcomes, solid outcomes. We need to ensure that countries include NCDs in their own national health and development plans. We must continue to emphasize the vital role that national governments have in moving towards its NCD targets. The importance of government-led action can be observed in Hong Kong itself. For example, the government has proposed to increase the size of graphic health warnings on tobacco products so that they cover 85% of the principal display areas of the pack. This is an excellent idea, and WHO applauds these efforts. The Director General of WHO herself endorsed this in a correspondence with the Hong Kong government and the Legislative Council. She stressed that increasing the size of these warnings would be a solid step forward for Hong Kong's implementation of the WHO Framework Convention on Tobacco Control and its guidelines, moving it closer towards the SDG target of strengthening the implementation of this convention. But it is also vitally important for Hong Kong itself because bigger warnings mean that the populace will be more informed about the risks of tobacco. By increasing the size of its warnings, Hong Kong would also keep pace with other countries like Australia, where pack warnings must cover 82.5% of the package, or Thailand and India, where they cover 85%, or Vanuatu and Nepal, with an even more laudable 90% coverage. I am hopeful that the panel on health services in the Legislative Council of Hong Kong will throw its support fully behind this important step, which will help ensure that Hong Kong keeps pace with other high performers in tobacco control. This is why partnership and your work is so vital. It is not just Hong Kong that you are helping. You are moving the global community a step closer to meeting its NCD targets. Although we face many challenges, I am confident that by working together we can save the next 15 million. I wish you all the best for a fruitful meeting and trust that we will soon see further progress on the prevention and management of NCDs in Hong Kong. Thank you very much.